Hi, all. Well, someone made a comment about what does the consent form look like. So this is Inova. I used to go to this hospital in Fairfax, Virginia, for platelet-rich plasma therapy. I declare that I or my child is 16 years of age or older. I further declare that I or my child have not experienced anaphylaxis, difficulty breathing, or severe allergic reactions from a previous vaccination or an injectable medication. Have not had any other vaccinations in the previous 14 days, i.e., MMR, Shingrix, varicella, or the TB skin test. Is not currently sick with a fever, active respiratory infection, or other moderate to severe illness. Have not received, see this here, other moderate to severe illness is so, like, this is so broad, right? Like, diabetes is a pretty severe illness, right? So some of the things that I have, like trigeminal neuralgia, it's pretty severe kind of thing. Even if you want to call it moderate, it's you can pretty much put anything under here, right? So you're signing this. Has not received monoclonal antibodies or convalescent plasma for treatment of COVID-19 within the past 90 days. I mean, what is this going to do? It's going to react with the mRNA? Is not allergic to the following ingredients in the COVID-19 vaccine: messenger RNA, lipids, 4-hydroxybutyl azine diol bis hexane 6 diol bis 2-hexyldecanoate. I mean, how would you know that you were allergic to this? 2-polyethylene glycol, that is antifreeze. 2000-N-N ditetracetyl acetamide, distyryl SN glyceryl 3 phosphocholine, and cholesterol, potassium chloride, monobasic potassium phosphate, sodium chloride, dibasic sodium phosphate dihydrate, and sucrose. Well, anyone who has diabetes shouldn't be taking sucrose. I mean, how would you know you were allergic to this stuff? I mean, could you even, if you were allergic to it, could you tell the doctor, sorry, sir, I'm allergic to 4-hydroxybutyl azine diol bis hexane 6-1 diol bis 2-hexyldecanoate? Like, could you even remember that? I understand that if I or my child have any of the above conditions, I or my child could be at a increased risk of having a negative reaction or problem from the vaccine. I further declare that if I or my child have any of the following conditions, I have had the opportunity to speak with my or my child's primary care provider, and I am making an informed decision to receive the vaccine or to have my child receive the vaccine. Number one, pregnant, attempting to become pregnant, or breastfeeding. Wow. I have friends that are pregnant that got this. Having a bleeding disorder or on a blood thinner. Like that's like most old people, right? How are on blood thinners. Are immunocompromised or are taking medications that affects the immune system, such as cortisone, prednisone, or other steroids, or anti-cancer drugs, drugs for the treatment of rheumatoid arthritis, Crohn's disease or psoriasis, HIV/AIDS, cancer, leukemia, ankylosing spondylitis, or radiation treatments. I agree to wait near the clinic for 15 minutes after receiving the vaccine. If I or my child have previously had an allergic reaction to a vaccine or injectable medication, I agree to wait near the location for 30 minutes after receiving the vaccine. Well, why, if you've already had a severe allergic reaction to the vaccine, why are you getting it when up here it says that I'm declaring that I have not had anaphylaxis or severe allergic reactions to a previous vaccine or injectable medication? I understand that the COVID-19 vaccine is a two-part vaccine series. By signing this consent, I'm agreeing that I or my child will receive the first and second part of the vaccine series. I understand that the common risks associated with the COVID-19 vaccine include but are not limited to pain, redness, or swelling at the site of injection, tiredness, headache, muscle pain, chills, joint pain, fever, nausea, feeling unwell, and swollen lymph nodes, lymphadenopathy, I understand that the vaccine may cause a severe allergic reaction, which can include anaphylaxis, difficulty breathing, swelling of the face and the throat, a fast heartbeat, a rash all over the body, dizziness, and or weakness. I understand that these may not be all of the side effects of the COVID-19 vaccines, as the vaccine is still being studied in clinical trials. I understand that it is not possible to predict all possible side effects or complications which could be associated with the vaccine. I understand that the long-term side effects or complications of this vaccine are not known at this time. I understand that the vaccination is being given by Innova Health System Foundation and its affiliates, collectively Innova. The owner and or operator of this site, their affiliates, officers, directors, employees, and agents expressly disclaim any responsibility for the vaccination. My consent is given in light of this knowledge and in consideration of Innova giving the COVID-19 vaccine. I, for myself and my heirs, administrators, trustees, executors, assigns, and successors in interest, do hereby agree to release and hold harmless Innova, its subsidiaries, divisions, affiliates, successors, assigns, officers, trustees, employees, volunteers, and agents from and against any and all demands, damages, losses, costs, expenses, obligations, liabilities, claims, actions, and cause of action, whether any of which is groundless or otherwise, of any nature whatsoever, including without limitation, reasonable attorney's fees and court costs by reason of or resulting in any way from any and all acts, accidents, events, occurrences, omissions, and the like related to or arising out of, directly or indirectly, my receipt of this COVID-19 vaccine. Innova makes no warranties, express or implied, including but not limited to implied warranties of merchantability or fitness for a particular purpose regarding the vaccine or its effectiveness. I acknowledge receipt of Innova's notice of privacy practices. Medicare Part B recipients. I understand Innova will process Medicare Part B claims on my behalf and accept Medicare payments in full. I understand I must present my Medicare card prior to receiving the vaccine. I understand that if I assign my Medicare benefits to a medical care advantage plan like an HMO or PPO, I must receive my vaccine, COVID-19 vaccine shot from my HMO managed primary care provider or pay the Innova charge. They care about getting paid, don't they? Private insurance participants. If I have private insurance, I understand that Innova will not bill my insurance carrier on my behalf, and I am responsible for paying the required fee for this vaccine to Innova and for pursuing reimbursement from my health insurance carrier. Innova cannot guarantee that this service will be reimbursed by insurance. Yeah, especially after this disclaimer, right? I have read and understood what to do if I have a reaction to the COVID-19 vaccination and the fact sheet by the FDA regarding the COVID-19 vaccination. Further, understand that Innova is required to submit COVID-19 vaccine administration data to the Virginia Immunization Information System, the VIIS, and report moderate and severe adverse events following the vaccination to the Vaccine Adverse Event Reporting System. I understand and agree to all the above, and I hereby give my consent to the staff of Innova to give me or my child the COVID-19 vaccination. Right here, please sign away your life and all rights. But we must do this, right? We must do this no matter how much we're scared, right? The government loves us. Big Pharma loves us. They would never hurt us. What to do if you have a reaction to the COVID-19 vaccination? Most people have side effects from the vaccination, but these last only 24 to 48 hours after receipt of the vaccination. A few people will have no side effects at all. Most people will experience pain or redness at the soreness at the injection site. Many people will have a headache, fever, chills, muscle pain, and or fatigue from the vaccine, particularly after the second dose. A few people will have nausea or swollen lymph nodes, lymphadenopathy. In rare circumstances, the vaccine may cause a severe allergic reaction, which can include anaphylaxis, difficulty breathing, swelling of the face, the throat, a fast heartbeat, a rash all over the body, dizziness and or weakness. What should you do if you have a reaction? Ice it if it's the red storm arm. Fever, take a non-prescription product that you would usually use for discomfort. If condition does not improve or worsen in 24 to 48 hours, call your physician. Unusual or severe reaction, example hives, difficulty breathing, wheezing, allergic reaction, call your physician, call 911, or go to the emergency room or the nearest urgent care center. In addition, you may report vaccine side effects to the VAERs. You can call Innova staff. Information about the COVID-19 vaccine. The COVID-19 vaccines are not live virus vaccines, so the virus cannot infect anyone. So the vaccines cannot infect anyone with COVID-19. All needles and syringes are sterile and one-time use and are safely discarded because we care about the environment. According to the data, the COVID-19 vaccine has approximately a 94% success rate in completely protecting those who receive it. The remainder have partial protection and will have greatly lessened symptoms if they do contract COVID-19. The vaccine will begin to provide about 1 to 2 weeks after the shot protection, about 1 to 2 weeks after the second shot of the series is given. At this time, we do not know how long the COVID-19 vaccine is effective for, so you may need future vaccines to remain protected. While the COVID-19 vaccination does provide protection against infection or greatly lessen symptoms if you contract COVID-19, you should continue to practice hand hygiene and use appropriate personal protective equipment, PPE. This sounds like the best deal ever, y'all. You got to go sign up for it. Just make sure you're not allergic to antifreeze or any of these other amazing chemicals that they're injecting us with. Big Pharma loves you. So does the government. I can't believe we're so lucky that we need to participate in this clinical trial. We should all be so honored. Thank you, Big Pharma, and thank you, government. I know you love me.